There are many reasons why someone can't make it out to see their doctor, like not having daycare or a car. That said, a new healthcare approach looks to change that. 23 ABC's Vanya Patino breaks down the new funding coming to expand healthcare access.
40 minutes away from Bakersfield. That is a drive that many people here in Taft have to make just to get the health care they need. That is why the Kern health system is going beyond the medical side and removing any barriers to get the people who need the help inside their medical centers.
I can't take my car to Bakersfield 4 or 5 times a week. I can't afford $400 a month in gas.
And she's not the only one. Trish Montez lives in Taft and is one of the 80 patients enrolled in the EMC, or Enhanced Medical Care Program, from Kern Health Systems. A bad case of COVID left her with a slew of health problems. And when transportation became an issue for her to continue her healthcare journey, the program stepped in.
I was taking the transportation that Kern Family, is given. I was taking that transportation to Bakersfield and home just to do my therapy.
And aside from transportation, the program removes other social barriers, like securing daycare or a translator if that is what's preventing someone from seeking medical care. This approach focusing on those who need the most attention.
They need access to several specialists, not just one, and are in and out of the hospital. So we dispatch a team. We partner with community providers, and they have a team that includes nurses, social workers, and community health workers.
Emily Duran with the Kern Health System explains it's a holistic approach that is already available in some parts of Kern County. But a new $14 million fund hopes to expand this program, as well as build new clinics across Kern.
This is meant to help build an infrastructure within our community that we are in desperate need of.
She says the money is also going to be used to expand the recuperative and respite care. Overall, adding it is geared towards rural communities and those with Medi-Cal.
And put your name right here.
Which in Kern County is over 340,000 people. And meanwhile in Taft, the EMC program has already been running for about a year.
As of today, we've got 4 healthcare providers that are working today, whereas if you backtrack maybe 2 or 3 years ago, we would have had maybe 1 or 2 on staff.
And as the only health center open on the weekends and after 5 p.m. during the week, those in need of the service are thankful.
Very, very helpful. And I'm glad that they're getting this extra money to be able to do for the other communities what really does need to be done. It does.
The $14 million is a one-time fund. That is why the Kern Health System tells me they are currently working on plans to make those programs sustainable even after that money dries up. In Taft, Vanya Patino, 23 ABC News, connecting you.